Welcome everyone. I'll give it just a minute for folks to join. Good afternoon. All right. So I know we've got quite the busy agenda today, so we'll go ahead and get started while some folks are joining here. So welcome to our data submission office hours call. I will start by introducing our presenters for today's session. So my name is Rebecca Licky. I'm our National Senior Outpatient Program Consultant here at the American Heart Association. I am joined by my wonderful colleagues, Liz Montgomery, Program Operations Manager, who'll be supporting us in the chat, Allison Smith, our Target BP Initiative Director, and Fatima Azar, Program Analyst. So before we get started, I wanted to review just a few housekeeping items. Please know that this meeting is being recorded and slides will be available after the presentation. You can enter your questions live into the Q&A feature of Zoom. And please keep an eye on the chat for messages from the AHA and AMA team. We will do our best to answer all questions during the call, but please know we will have additional office hours before the data submission deadline to answer any future questions, and are also always available via our contact us form and help desk. Additionally, we also do have captioning and a transcript available, but you can turn that feature off if it's distracting using the hide subtitle option or resize the captions to make them easier to read under subtitle settings. So our agenda for today's call will begin with an opportunity to identify which topic you have the most questions on, followed by an overview of the data submission process with timelines and resources. We'll pause for an open Q&A and then follow with some answers to common FAQs that we get, and then end with some additional time for questions if needed. Okay, so let's get the poll started. We'd love to learn from you, which category do you have the most questions on currently? Are they technical data submission questions, measure specifications, timeline for submission and awards, attestation questions for Target BP, attestation questions for check change control cholesterol, or for Target type 2 diabetes? We'll give it just another couple of seconds. Let's see where we're at here. So we have nearly a tie. So measure specifications, technical data submission questions being some of the most, attestation questions for Target BP being right after that. Well, all righty. So let me X out of that on my screen. All right. Let's get started with a quick refresher on some key data submission reminders. Okay, beginning with our timeline. Right now, you can submit, edit, and revise your 2024 data in our online data platform. The deadline for data entry is Friday, May 16th at 11:59 p.m. Eastern Time. Data will be captured at exactly midnight Eastern Time, 1 minute after the deadline, to determine the award status for all sites. Next, the AHA and the AMA will be reviewing and validating the data submitted to classify awardees by award level. You might hear from us during that time, mostly in June, if we have any questions about your submission, and your response will help confirm your appropriate award level. Then during the fall, we will then notify 2025 awardees with your congratulations email and toolkit and celebrate your accomplishments on our program website. The recognition doesn't end there, though. We'll follow with additional highlights of awardees at scientific sessions and certain local events. So keep in mind there are two general steps to submit data for award achievement. The first step is to register. This enables us to create a profile and user login for you in the online data platform. If your organization is new to submitting data, you can go to heart.org/registermyoutpatient.org to register. If you have submitted data before and already have a profile, you do not need to re-register. You can skip straight to entering data, which we'll cover next. On that registration form, we'll ask you some basic demographic questions and, importantly, what initiatives you wish to register for. You can register for all three at the same time, and if you are considering participating in any three, I do encourage you to select all of them. If you decide to add an additional program later, you will need to complete the form again. So starting with all three will save you some time in the long run. We'd like to note that one registration equates to one potential award. So if you want your health system and each of its individual locations to all be listed individually and each receive a certificate, you'll need to submit registration forms for each. If you want to register 5 or more sites, there is a multi-site submission process in that registration link that saves you some time. The second step is to submit data, starting by logging into our data platform. You'll navigate to program forms, hit add new, enter 2024 because you're entering data from calendar year 2024. Fill in all the fields, check the data entry complete checkbox, and then save and exit. You can save and return to revise your data up to the May 16th deadline. I know this is a super simplified quick walkthrough, but we'll show where you can find some more detailed information in a little bit. We also want to encourage you to submit your data earlier in the submission cycle if at all possible. The reason for this is that we want to make sure that we can provide you with the best support available when troubleshooting any errors. This might be maybe a confusing question you need support answering, or it might be a technical issue uploading your data. As you can see here, we tend to get the vast majority of our data submissions in the final month, and our team is supporting nearly over 15% of data submissions on the final day alone. Our team will do the best we can to help you get your data in on time, no matter when you submit. But if you submit earlier, we'll be able to have a bit more hands-on because we'll have a greater capacity to do so. Okay, let's walk through some of the basic award criteria that we run into common questions on. So first, who is eligible for an award? We have a pretty broad range of outpatient organizations that participate, but fundamental criteria is that your healthcare organization, as registered and as submitting data, must directly diagnose and manage patients with these chronic disease conditions. This means that your organization must be prescribing and managing the medications of patients with these conditions. It also means that if you are primarily a screen and refer organization, that you would not be eligible for an award. Our quality improvement tools and resources, though, remain freely available to all. Next, some of the data we ask will be identical across program forms and can be copied and pasted from one form to another. Target BP, check change control cholesterol, and target type 2 diabetes will all ask for your total adult patient population, which is question 3 on all forms, a breakdown of that total population by race and ethnicity based on a simplified version of Table 3B from the HRSA Uniform Data System reporting requirements for 2024 health center data. Note that we ask for you to narrow it down to the adult patient populations from question 3. a breakdown of that total population by patient's primary care, and then your total number of providers. So this year, all forms include some new follow-up questions contingent on your answers to the measure criteria. The first will be prompted if your denominator is 10 or fewer patients. We'll ask for some additional context on why there are so few patients meeting denominator criteria, and if applicable, why your overall patient population may be small. The next question is only prompted in target BP and check change control cholesterol. If your performance on the measure is over 90%, we ask that you verify the data and, if accurate, provide details that may be contributing to your high performance. If you see either of those questions in the platform, you must fully answer them to be eligible for an award. We've also added a new quality improvement question on each program form. Through these questions, we're aiming to learn more about how healthcare organizations are improving the quality of healthcare delivery. These are required to be completed as they will help us to develop our quality improvement materials and design relevant programs that meet your needs. The question on each form is tailored to that particular chronic disease risk factor. So to get into further initiative-specific details, I'm going to pass it to Allison.
Thanks, Rebecca, and welcome everyone. Thank you for joining us. I'm just going to quickly run through at a high level the data submission requirements for target BP. Starting with the controlling high blood pressure criteria for MIPS 236. The denominator for that measure that's critical for you to submit is really focused on adults 18 to 85 years of age who had a visit in the year 2024. So that's the performance year that we're referring to in this year's data submission. And they had a diagnosis of essential hypertension either before 2024 or during the first 6 months of that year. I want to just call out to be sure to exclude patients who are pregnant, and there are some other exclusion conditions that you should consult the measure specifications for. That'll ensure an apples to apples comparison, and that you're including patients who meet those measure specifications. In the numerator for that data submission element, we're looking for patients who have a diagnosis of hypertension, who meet the denominator criteria, but also who have blood pressure controlled to less than 140 over less than 90 millimeters of mercury. And so I want to this table in the center of the slide has a few nuances to think about who is included or excluded in the denominator of this measure. And so taking the first row as an example, if a patient had a visit in March of 2024, and that was the first time they were diagnosed in March in 2024, that would count because they had a visit during 2024 and it happened in the first 6 months of the year. If, for example, their visit was in October, and that was the first time they were diagnosed in 2024, then they would not be included in the numerator or the denominator because the diagnosis didn't occur until the last half of the year. They will be included in next year's as an example, however, and so on. So hopefully that helps think through who gets included and who gets excluded from the denominator. There's also a question, a yes, no, or not sure question, asking if the data that you're reporting includes patients who have remote blood pressure monitoring readings that were used to determine if their blood pressure was controlled. That is permissible. And it has no bearing on your award status. We just like to know if you're including that data or not. It helps us understand more about your practice and how you're delivering care. In addition, there are evidence-based activity attestation questions. There are now 6 questions for all 5 pillars. We had a dry run of those additional questions last year that did not count toward your award status. This year they will, so there's some exciting new opportunities. So we're really looking forward to seeing how your practice is addressing those critical elements of hypertension control. And as Rebecca mentioned, there's also a new question about your quality improvement activities. We're just trying to understand, are you using Target BP resources? Are you receiving other grant funds or participating in other local institutional regional or national initiatives, so that we appreciate the resources that are contributing to your success. On the next slide, I just want to remind you of the evidence-based activity pillars. This is just a snapshot of what those questions ask in a little bit more detail. The Measure Accurately pillar has been there for 3 or 4 years now, so that it should be very familiar. And for those of you who participated last year, you were exposed certainly to the other 4 new pillars. And we ask, again, those 6 questions in each pillar: yes, no, or unsure. And depending on if you answer 4 out of 6 at a minimum of those questions affirmatively, they can contribute to your award status. In order to achieve the silver award, that will remain the same, just attesting to 4 out of 6 of the Measure Accurately pillar. And now, excuse me, to achieve the new Silver Plus or the new Gold Plus criteria, you would need to attest to the 4 out of 6 of Measure Accurately, 4 out of 6 of Act Rapidly, and 4 out of 6 of one other pillar that's illustrated here. So with that, I want to hand it back to Rebecca to carry on, and I'm happy to take questions in the chat or during our pauses if you have specific questions about Target BP attestation questions or the measures. Thanks.
Thank you, Allison. All right, so looking at the statin therapy measure MIPS 438, there has been a slight change in the denominator criteria, which I'll review in just a second. The measure overall, though, looks at of patients that fall into now 4 risk group criteria, how many of those patients have been prescribed a statin for their high cholesterol. I do also want to note that we've added new attestation questions around the PREVENT calculator, as well as one to further understand your quality improvement activities, which we just touched on. So the changes to the risk group conditions include an adjustment of age in the second denominator criteria to patients aged 20 to 75 years, and then the addition of a 4th risk group that includes patients from 40 to 75 years of age with a 10-year ASCVD risk score of greater or equal to 20%. So similarly to the award criteria for Target Type 2 diabetes on the next slide, there are no major changes to the data submission questions or measure specifications. As in previous years, organizations will be asked clinical practice questions on standard protocols, treatment plans, which does include the new PREVENT calculator question that we just talked about, guideline-based pharmacologic therapy, kidney health, and then a new question regarding those QI activities. So as I just noted, there is no change here for the number 1 measure, HbA1c for control. As a reminder, though, this is an inverse measure. So we are looking at the number of patients 1875 that have a diagnosis of diabetes, and then how many of those patients are out of control as defined by an A1C greater than 9. So for this program specifically, we also do require measure submission for 1 additional measure, and you have the option to submit data for either MIPS 236, the controlling high blood pressure measure, or the statin therapy MIPS 438 measure. So this slide really just illustrates the submission requirements for the Target Type 2 diabetes program, and that the denominator and numerator requirements are identical to the other program data submission. So if you are participating in multiple programs, that data is identical. All right, before we move on to answering questions from the through Q&A, I'm going to do a quick run through of the resources available to support you in data submission, so that this way, if we refer back to a specific resource as part of our answers, you have a foundation on what we're speaking about. So first, we've created a couple of new web pages to make the full process of registering, submitting data, and utilizing our benchmark reports clearer and easier. You can visit heart.org/outpacecvd platform, to walk through the steps and access all of the resources that we'll be walking through in a moment. So this will be your centralized hub for all of these things. So this will include resources for target BP, check change control cholesterol, and target type 2 diabetes. You can also find a similar webpage on targetbp.org called Data Platform Resources underneath the awards banner at the top. Click through steps 1 through 5 to see each of our recommended resources for each step in the process. So looking more closely at our resources here, we have several that are focused on the technical processes of submitting data. Our quick user guide is a PDF that goes further into depth on the quick walkthrough that I provided earlier, whereas the Navigating the Data Platform PDF and video provide additional detail on setting up your site characteristics and utilizing various benchmark reports to support your quality improvement efforts. Every year, we also create a new how to submit data video that includes a full walkthrough of answering each question for each program, along with common errors. So we also have resources that are more heavily focused on the questions themselves, so providing some additional clarity and context. Our data collection worksheets are the go-to for this, and my top recommended resource as well. Additionally, we have FAQ documents for each program and partnered initiative. And if you take a look in the chat, Fatima is dropping in links to all of these as I'm talking about them. So thanks, Fatima. For our target BP pillar questions that really go into the weeds on clinical practices and overlap with quality improvement activities, we have a full webpage dedicated to the evidence-based blood pressure pillar activities and a deep dive toolkit with resources and examples. I also want to call out one additional resource we have available. If you are submitting data for multiple sites, we do have an option that allows you to upload a CSV file for all of their data at once. If you are only submitting data for a couple sites, it is still easiest to go through the program form, which is the method included in the previous resources. But if you have, say, 10, 20, 60 sites that you're submitting data for, we find that this uploader tool will save you a lot of time. If you are interested in this option, please do work with your local AHA representative. They'll provide you with templates and detailed instructions. And if you aren't yet in touch with a local director, you can reach out to our Contact Us form and we'd be happy to connect you. Okay, I think we are at Q&A time. Yes, we are. Awesome. Okay, let me switch over my own screens here and look to see what questions we have come in.
Thanks, Rebecca. I'll just jump in to reinforce that the webinar is being recorded because that question's come up a few times and it'll be available on the website once the closed captioning has been applied. So you all will have full access to that for sure. So that was one question that came up. And there's some other specific ones that I know have been, that are sort of institution specific, but I'll generalize one of them, which is, if I work for a large health system, do I have to submit data for the whole health system or a specific clinic or selected clinics? And I think, as you pointed out, Rebecca, you do have the option to choose any of those based on your preference and interest, and the scope of the data, and the attestation questions would correspond to the universe that you chose. So whether that was an individual clinic or a whole health system or something in between. But you also mentioned the convenience of the data uploader if you have more than 5 sites that you want to, that you want to submit data for.
Yeah.
I don't know if there are any others that you wanted to touch on that were
yes,
already.
Please. So I think one participant had asked about minimum denominator requirements. So they have some sites that are more pediatric focused, but still see adults that do meet denominator criteria. So so long as you have some patients that meet the denominator criteria, that in that way you'll be eligible for an award. If the denominator, though, is very small, we might have some follow-up questions to better understand your organization. But if you are managing and treating adult patients with these chronic disease conditions, then we, of course, encourage your participation. So even though there is some, pediatric maybe in your population, so long as you are, identifying, treating, managing adults with these chronic diseases, you should be good to go. Okay, and I'm just seeing if we have any more open.
Yeah, I think the other ones may have been very, practice specific. So we're going to do some offline follow-up on those, which are always happy to do.
Absolutely. There's one more I would like to touch on regarding the MIPS 438, which is the statin therapy measure. So somebody had asked, is the fourth in the newer criteria population for the cholesterol measure necessary for data submission? The answer to that is yes. All risk groups that are part of MIPS 438 are required for check change control cholesterol. This way we are ensuring we are holding all organizations to the same measure. Okay. Flip back to the chat. And so we will have another time for Q&A in just a little bit too. So I'm not seeing anything specific. We want to maybe move forward and we'll come back and answer some more questions in a little bit. Okay, so let's walk through some common questions and scenarios, and maybe this will drum up a couple more ideas for questions or maybe answer questions that you already get. First, how do you update a name change for your organization to ensure the correct name is on your award? You can do that by contacting us at bit.ly/AQ contact us, and we will ensure the correct name is reflected on your award. However, if you've undergone a merger or any other major legal change, we may need you to re-register. Next, how do you start submitting for additional programs if you have been submitting for one for a while? In this scenario, if you've been participating in, say, Target BP for the last few years, and now you would also like to submit data for diabetes, you can do so at heart.org/registermyoutpatient.org. You will need to acknowledge the legal agreements for that program. So if this is your first time submitting data, we do recommend that you register for all three, as we've said before, to save you some time needing to do this potentially in the future. If you wish to register multiple individual sites at once, there is a link to our multi-site registration process therein. All right, next question. What do you do if you can't log in to the data platform? Well, if you are a brand new user or are replacing a staff member who submitted data previously, you can contact us at, again, bit.ly/AQ contact us and have that memorized by the end of this. If you've been in the platform before and you have an existing username, you can try the password reset option or contact our IT vendor at infosario.outcomesupport@quintiles.com or at the bit.ly contact us link for help. I do want to mention that if your organization is brand new and you just registered, it may take up to 3 business days to receive your login info. All right, moving on. What happens if your organization does not capture race or ethnicity data? If you are unsure of patients' race or ethnicity, you can place them in the unknown grouping. Though we do highly encourage you to aim to submit this data, and this could mean identifying the appropriate unit in your organization that has this data instead of applying sampling methods or averages. But if you cannot allocate these data, you can use the unknown grouping to the best of your ability, but we may have to reach out for additional clarity to validate that. Next, if your health system includes multiple different specialties, including dentistry, behavioral health, et cetera, how do you include those encounters in the total patient population and or the measured denominator? The answer to that is no. Our achievement awards focus specifically on care that's provided in outpatient settings by providers who actively diagnose and treat these conditions. So please filter your data to exclude dental and mental health care encounters and include only outpatient medical care encounters with providers who do meet this criteria. Okay, Allison, this is a question that we get quite often in Target BP as when questions refer to monitoring to assess the use in policy or practice. What's the minimum standard in that? What are the requirements of monitoring? What does that look like?
Yeah, thanks for that question, Rebecca. The general concept behind each of the pillars is to say what is the standard of care that's evidence-based and guideline recommended, and are we checking? Have we defined that, and are we checking to see if we're following it? Because we all know a policy and procedure or standard or protocol that sits on a shelf isn't really impacting care. And so what we're prompting here is sort of, have you defined a standard, and then what are you doing to see if you are monitoring it? What are achieving it? We're not assessing rates of performance. You may be performing 100% of the time adherence to your standard of care, or 50% of the time. That's a quality improvement opportunity that it does not, and that performance does not hinge on these attestation questions. Examples of how one might do that: some organizations have sophisticated EHRs or population health tools that allow them to do queries or generate reports that show adherence to certain aspects of your standard of care. Other organizations lean on good old-fashioned chart review, which is a manual process, or something in between. Those are all acceptable forms, and there I'm sure are other examples, but those are just sort of two examples of how you're meeting the spirit of that criteria to see if those activities are happening in accordance with the standard of care that you set for that particular attestation question. All
And
right.
yeah, so next, I'd love if you can talk, this is another one that we get, probably our number one question. If you could talk a little bit about the different BP quote numbers, what they are, why are we asking about two separate blood pressure thresholds?
Yeah, sometimes there's a swirl of numbers like what's 120, 130, 140, why, how are we using them, and what is the significance in their difference? And this slide just helps to sort of define and lay out for a reference how this then plays into the attestation questions. So we think about the rainbow chart that's pictured on the left there as the diagnostic thresholds defined by the 2017 ACC/AHA guideline of what blood pressures are normal, elevated, high, etc. And for that threshold, we know that less than 120 over 80 is what is defined as normal blood pressure. In the guideline, we also define treatment goals. So for adults with confirmed hypertension and known CVD or 10-year ASCVD risk of 10% or higher, the guideline recommends that the treatment goal is less than 130 over 80 for those individuals, as an example. So that's a treatment goal for a person. We also see, and that's mentioned in one of the attestation criteria, which I'll get to in a minute. And then we also know that nationally, there's a definition for performance measures, and the National Committee for Quality Assurance has defined the performance measure for controlling high blood pressure, and the threshold for calculating that is looking for patients who have blood pressure that is less than 140 over 90. So there's a difference between a diagnostic threshold, a treatment goal, and a performance measure. That's where these different numbers are coming from, just for context. So on the next slide, just to clarify with the actual data submission requirements, When we're asking for information about your blood pressure control rate, that is speaking specifically to the performance measure, MIPS 236, that uses less than 140/90 as the threshold for determining control through a performance measure lens. In the attestation question, in the A pillar or the Act Rapidly pillar, there is a prompt asking if your treatment protocol defines less than 130/80 as the threshold for treating individuals with confirmed hypertension. And really you're attesting to say, yes, that is included in our algorithm. No, it's not, or I'm unsure. And so that's speaking to the threshold that you define in your algorithm. Whether or not you're meeting it, as that the performance measure or the performance of that is not what's addressed here. So hopefully that clarifies the difference between the performance measure that we use in your control rate versus the attestation question that's asking how you operationalize that in your treatment algorithm in your practice.
Thank you for that clarification. Sure. Okay, and lastly, this question is specifically for target type 2 diabetes. Will your measured data entered for the other program submissions be auto-populated in the target type 2 diabetes form for the measure option? The answer here is no, sadly, much to our dismay. Currently, data is not shared between programs, so your responses in Target BP or Check Change Control Cholesterol will not pre-populate in the Target Type 2 diabetes form or vice versa. The solution, however, is that through the Program Forms tab on the data platform, you can easily toggle to your 2024 form for another program and just copy and paste your responses into the Target Type 2 diabetes form. Okay, and I think we have a couple of more questions coming in. So again, feel free to continue to use the Q&A feature. We'll have lots of time for questions. So we'll be opening the floor in just a second for that. But before we do, I'd like to share just a couple of tips for success. One, we encourage you to register new organizations early, as it can take up to 3 business days to process your registration. 2, we recommend entering and saving your data as early as possible. This will allow our staff time to confirm your submission is complete and provide you with support in troubleshooting any questions you might have. We shared a lot of resources today, but I recommend that the data collection worksheets and the quick user guide will be your best go-to resources. Last, if you make sure that the data entry complete checkbox is selected and you are able to save, that will ensure that you have completed everything that you need to on your form. And of course, the biggest tip for success is to just stay in contact with our team. We're here to offer support and answer any of your questions. Okay, so at this point, let's go back to the Q&A and see if we have any additional questions.
I'll jump on with one that I did see, Rebecca, and it was a question about the evolution of the award criteria for Target BP. And I'm going to drop a link in the chat to the page on the website where the new award criteria are outlined. But essentially, the participant level criteria are the same. So if you're a first-time data submitter, you are eligible for the participant award. The silver award criteria are the same. So you can submit your data and attest to at least 4 out of 6 of the measure accurately attestation questions that were described in the pillar. For Silver Plus, which is a new award level, you would submit your data, attest to 4 out of 6 of the measure accurately pillar questions, the Act Rapidly pillar questions, and 1 additional pillar of questions. The criteria for the Gold Award are exactly the same. So it's organizations submitting their data and reporting a control rate of greater than or equal to 70% for their patient population. And then the Gold Plus category existed before, but the criteria have gotten a little tougher. So they're still the same blood pressure control threshold of 70% or greater, but you would need to attest to 4 out of 6 of the measure accurately, act rapidly, and one other pillar of your choosing. So hopefully that clarifies. So the question was specifically if we were Gold Plus before, but don't have the additional attestation achievements, you could certainly still earn the gold level if you hadn't been able to attest to the act rapidly and another pillar during the year of 2024. So hopefully that helps. Other questions, Rebecca, that you're seeing?
Yeah, there was one earlier regarding the race and ethnicity table. So somebody had asked for patients that identify as multiple ethnicities, that they, currently only count them as more than one race, and not count them in any of the individual race fields. So essentially, if a person identifies as Asian, Black, and white, would only be counted as that sort of more than one race and not counted 4 times, which is correct. Each patient should only be counted 1 time in the race and ethnicity table so that the sum equals the total patient population that is given in question 3. And there is a feature in the platform that ensures that those equations add up. So it'll flag you if it does not add. All right. Any additional, the rest of the questions I'm seeing, I think we answered previously. So feel free to submit any and all questions that you have. Anything regarding registration or data submission, the course target BP pillars, the self-service upload tool, certain reports for visualizations or comparators, benchmarks. There's quite robust programs, and we understand the data submission process is as much as we wish it was as easy as just clicking in our lovely easy buttons. We understand it can get a little bit complex, so we're here to answer any question that you might have.
Yeah, and I don't think we planned any more. We didn't have any other prepared content at this stage, or we have backup materials that we're happy to visit or revisit any of the things that we've touched on today. I do want to underscore how valuable the demo videos are, the short version and the long version. I know you touched on those, Rebecca, but it really helps to sort of walk through and kind of anticipate what that experience is going to be like. So those are terrific and newly updated. So
yeah, absolutely. Okay. So there's a couple, good. There's a few questions that are coming in here. I'm gonna ask Allison, let's see. All right, let's start from the top. For the ages, they must be within the age range at the date of encounter, correct? So for blood pressure, are there some questions that are 1885 and others that are all adults? So this seems to be for measure submission specifically.
yeah, so in your numerator and denominator, you're only going to include adults who are aged 18 to 85 during 2024. So hopefully that clarifies that question. Good one.
Thanks. All right, and another blood pressure question. So regarding the attestation question, follow-up contact within a 1-month period for patients with stage 1 to 2 hypertension who have not yet reached their hypertension treatment goal. Is there a threshold for how many patients had a follow-up appointment with the 1 month in a 1-month period? So like, for example, if 80% of these patients with stage 1 to 2 hypertension had a 1-month follow-up, would that count as yes?
Yeah, if you could flip to slide 61, that's a great question. So I think you're specifically referring to, these are the actual attestation questions listed here, and I think you're referring to the last one on this list. And so these, just walking through these 6 attestation questions, it's, do you have basically a hypertension treatment protocol in place for your practice? So, that is in place. That's question number 1. Do you monitor to see if it's used? Again, you choose how you monitor it through a sophisticated EHR evaluation, an old-fashioned chart review, or something in between. The level of performance or adherence to that protocol is not something that we are evaluating. This is a if you have it and if you do it, those first 2 questions. And then the latter questions have to do with the content, the substance of that protocol. Does it specify a treatment goal of less than 138/80 for adults, et cetera? Does it prompt some type of treatment intensification if a patient isn't at goal? Does it specify some adherence strategy, such as the use of a single pill combination or prescription synchronization, as an example? And does it prompt follow-up for patients within a month if they're not at goal? Again, these latter 4 things, we're not looking to see how well you're performing them, but we want to make sure that the protocol is in place to include those things. So hopefully that answers your question, that we're not looking to see a certain particular level of performance. I think the concept here is that if you're doing these things consistently, you should see the results in your control rate. So since we know that treatment intensification is the most powerful thing that you can do to improve blood pressure control, a patient, can't take a medication that he or she isn't prescribed. So this is the cornerstone of blood pressure control. All right.
Great. Thank you so much, Allison. Okay. Let's see. So we had asked if I have data starting March of 2024 instead of January, since the clinic is new, was started in March until December, can I still participate with data for less than 12 months? Great question.
Yeah, you're welcome to participate. I think it's especially, we welcome all newcomers, and that's why the participant award certainly is in place to welcome newcomers. I think it'll be, it'll certainly be more challenging to, achieve some of the requirements or the performance levels with a lesser period of time to do so, but you certainly can.
Absolutely. Okay.
And I think there was a question about looking at the multi-site submission process, and I think Liz was going to maybe respond to that. Is that what I'm seeing here in the?
Yeah, I can hop off mute for just a minute. Bear with me, everyone. My voice is coming and going today, but we didn't prepare any slides showing the multi-clinic submission tools. However, I do have the website pulled up. So this is just, I can show a little bit of a preview, but not every material that we have to help support you along the way. But essentially what it looks like is when you log in, you'll see all of your different facilities listed out that are part of that system. And then you'll have an individual health system profile that you can click into. And that health system profile will connect you with the tool to upload your data. So you would, when typically if you're in the program form view, you'd go, or when you're in the individual site view, you go to your program forms. When you're in the health system, you'll go to upload. And let me, it's always a little bit slow when I go live. But at the top of this page here, this is basically your upload page, and you'll see at the top which program form you want to select. and you'll have a CSV file that you can then drag, drop, choose from your computer, and that will be it. We have a prep file that helps you to walk step by step, but you'll be filling out the exact same questions that are on the data collection worksheet and on the program form. So it'll be direct alignment. We just have a couple of resources to make sure that you complete the CSV file in a way that aligns with the program forms and connects all of the required fields. So I hope that helps, and your local AHA representative will have access to all of those tools. We've got more demo videos for that, instructions, etc.
Alrighty.
And what is if someone isn't connected already with their local AHA representative, what's the best way for somebody to find that out? Rebecca, do you?
Yeah. So I know I've mentioned this link a couple of times, but I will mention it one more time at bit.ly/AQ contact us. You can go ahead and fill that out, and that will get automatically directed to a local staff who is there to support you. And we do quite a bit of communications between the teams. So we are always in touch with them if it is a question or a support issue that is more appropriate to be handled by the national team or potentially by IQVIA themselves for more technical support. We can always route it that way too, but always as a first starting line, you can visit bit.ly/AQ contact.
Well, we're here for about 10 more minutes. If anybody has any lingering questions, we're also happy to take those questions offline if they're really site specific or harder to explain.
Absolutely. Any additional questions? As Allison said, we'll hang out here for the rest of the hour. If, again, feel free to ask any questions in the Q&A, or you can also, you have the option to raise your hand too if you wanted to come off mute and ask the question live if it's easier to explain it than type it all out. You can feel free to raise your hand as well.
I really want to thank everyone for coming, for your attention and your engagement in this, not just through the data submission process, but in all the work that you did in the preceding year to get here. We're really thrilled to see how this audience and community grows every year, and to see the amazing progress that's made in improvement in the adoption of evidence-based practices and higher control rates and performance measures. So it's really hats off to you and your team's hard work.
Absolutely. Yeah. Thank you, Allison. Truly, it's been tremendous to see every year. We happen to, we keep growing, we keep, meeting new people, seeing new faces. And I think what we love the most is just the sheer level of engagement that we see from all of you throughout the data submission process. So thank you all so much for your time, and we are here to support you in any way. Yeah, good point, Allison. Slides and recording will be available soon. I know we've mentioned that in the beginning, but as always, we will make sure to follow up with both of those resources.
I do see one question that has popped up in the Q&A. Is there a way for the platform to connect with other people from different practices who have done this process or in the process? I appreciate that question, and we can certainly, I think your local HA representative is probably the person who can best connect those dots locally and understand if there, there may be a peer institution who might be willing to collaborate on that level. They have, I think, the best handle on those relationships. So you might reach out to your AHA local community impact staff if you have a relationship with that person, or use the contact us link to find out or be connected with that person. And I think they're probably best positioned to facilitate that type of engagement.
Yeah, absolutely. Thank you, Allison.
We're big fans of peer collaboration and
yeah,
peer learning. It's very powerful.
It is. It is. And I will say too, if you are not already connected with your local AHA staff, highly, highly recommend doing so. They are just a tremendous resource for being able to connect those dots at a local level to support your organization, but also to let you know about local events that you might be able to network with other local organizations close to you. I know, quite a few areas will do yearly, hypertension summits, or they'll do, larger, diabetes events where they'll have a local expert come in and talk to healthcare organizations in a specific region. So those types of events do occur. Feel free to reach out to your local staff to see what's going on in your area. All right. Well, I don't see any additional questions coming in. So again, thank you all very much for taking the time this afternoon to learn a little bit more about the data submission process. We appreciate you all. Hope you have a wonderful rest of your afternoon. Thanks.